السلام عليكم جميعا يعطيكم العافية. Thank you for having me in this presentation. Inshallah, today I will talk about patient activation measure in patient with rheumatoid arthritis. It was a systematic review and a meta-analysis. I declare no conflict of interest. This project is a part of a great research team. My name is Hayal Malik and I'm a clinical pharmacy and rheumatology. I will talk in general about patient activation, introduction to this project, the methods that we used, results and conclusion. Patient activation is defined that having the knowledge, skills and confidence and behavior needed for managing one's own health and healthcare. Patient activation was defined by Hibbard at 2004. So why do we need the patient to be active or involved in therapy? We need to assess or quantify patient activation because it can helps us to know who is the patient that need more support, how to tailor support and information to give to the patient, and to measure also the performance and for the patient to have better quality of life. So why do we need patient to be active? Because active patients are usually able to work more, they can manage their condition better, they're healthier, they use less health service, and they optimize the use of their medication. So patient activation is assessed and quantified by the patient activation measure, which is a survey. It was 22-item survey, then it was reduced to a 13-item survey. This survey is a valid and translated tool, and it is considered the gold standard for assessing patient activation in multiple studies. So what do we mean by different levels of patient activation? The level 1 patient, meaning that the patient is leave the charge for the physician, so the doctor is in charge of my health. The level 2 patient, it means that the patient could be doing more or could be involved more. Level 3 patients are part or can collaborate with consultants in taking care of their health. And level 4 patient, meaning that the patient is an active patient and they are an advocate. So why do we assess patient activation, or it is important to assess patient activation? Because it was found to be correlated to decrease in hospitalization and also to increase in medication adherence. So from this came the aim of the study. We conducted a systematic review using a PRISMA and a cross-sectional survey. The cross-sectional survey was done in the rheumatology specialized clinics, which is a multidisciplinary clinic at King Khalid University, King Saud University Hospital. And we did a systematic review, putting a search keywords in 7 databases on any project related to patient activation and RA. So regarding the systematic review, we got almost 2,000 records, and we included in the analysis 17 with regards to patient activation and RA. So for the results of the review, only 17 were published between 2012 and 2021. And these studies were very inconsistent in quality, and patient activation ranged from 29 to 76%. Regarding the cross-sectional part, we did exploration between characteristics of different patient population. We included 179 patients And age was a confounding variable. Patients were more active and were younger, have less disease activity, and also use less medication. This is the patient activation level of our population included in the survey. Patients are considered active, mostly level 3 and level 4. We tried to explore differences between the medication and patient activation. It was found there is no relation between different therapeutic options. Also, this is the results of the linear regression, that we found that the specialized clinics or patient attending a specialized clinic usually have greater patient activation. So the results of the cross-sectional survey, most of our population were active, measure level 3 and level 4. And we found out that patients who are attending the specialized rheumatology clinic had greater patient activation, and patients with high PAM score were younger and have less active disease. So in conclusion, the study is very heterogeneous when it comes to systematic review. Patients have high activation. Specialized clinics could provide better patient care, and larger multi-center studies are needed. Thank you so much.